Do. Hello! I am so excited. This has been something I've been waiting for a long time. This is the lovely Dr. David Levine. I think I've waited 6 to 8 months to get you on here. You're a very hard man to pin down.
It's tough when you're in jail. You have to, wait till you're out, and then I'm kidding. Yeah.
I know, really difficult. So basically, tell our followers a bit about yourselves and why I personally am so excited to have you here.
Well, first, I'd like to thank you for having me, and sorry for the delay. Life is crazy, and then we had COVID, and I travel a lot, and in the clinic a lot. I teach a lot. I do a lot of different things, and it's 6 months probably is being generous. It may have taken you more.
Yeah.
Down, but
so what you do.
What do I do on any given day? I don't know, but every day is kind of different. But I originally was trained as a physio back in the 80s in the U.S. Some of my doctoral work was in experimental medicine at the Veterinary College, and so I started to work with veterinarians in the early 90s. Did a veterinary technician program as well. Let's see, along the way, picked up a master's in orthopaedics and doctorate in experimental medicine, a doctorate in physical therapy. I'm actually working on a master's in public health now. I get to go to courses for free. So I also work in infectious disease, so bacteriology and virology, and that's kept me quite busy with COVID. So I do a lot of work in infectious disease, pediatric on the human side. And also on the veterinary side, we culture clinics and we look for bacteria that are problems, and then look at sensitivity. So, and then another diagnosis that's I work a lot with on the human side is Eeler's Danlos syndrome. So disorder. I work with a group of people worldwide on EDS and have a lot of projects.
Is that when their connective tissue is really quite bendy?
Yeah, and that's one type. That's the hypermobility spectrum. There's a lot of different types. Some affect, organs, the heart, the internal organs, kind of like osteoarthritis, to bring it back to our topic where, we think of osteoarthritis affecting the joints, but it affects a lot more than just the joints.
Right.
So work with EDS, and I mainly and in the clinic I work at is VC, wrong pocket. There we go. Veterinary care and specialty group in Chattanooga, Tennessee, where I work in rehabilitation there. And we have lots of board certified surgeons and neurologists, a big group of folks. And we are our goal is to try to elevate the standard of veterinary care.
Yeah.
So that's kind of what I do on a day-to-day basis, and avoid speaking for Hannah as well as I try.
I know you've been avoiding me like plague. So from my perspective, guys that don't know David Levine, he is a world leader. He is an educator. He really, I'm hoping tonight we're going to start approaching OA with a much more global perspective of what this disease can actually do to the body, so people can have a better understanding about how different interventions really fit in and how they need to be prioritized, being discussed in a multimodal management plan. So what we're going to do is we're going to kind of dabble a little bit about the joint initially, but we're going to really quickly transfer to more soft tissue related issues with OA. Because from my perspective, I've been a vet for 18 years, and it wasn't until 7-8 years ago that my eyes were opened to how OA can actually affect the rest of the body. And I felt so stupid. I felt so ridiculously stupid that I hadn't seen the bigger picture. And as a vet, I'd really concentrated on pain management related to joint pain rather than looking at, soft tissue changes as well as behaviour. Behaviour was yesterday. We're going to come back to the next week. But so let's jump straight in. Okay.
Can I ask you a question first?
Yes.
To turn it around on Hannah a little bit here.
No.
You mentioned that OA affects a lot of things besides our joints. And I love that you said that. If you think about, would you say that OA affects the cardiovascular system?
Yeah, because it will affect their physical fitness.
Great. How about diabetes? Does it increase the risk for diabetes?
Because of cortisol, stress levels. So that should affect your glycemic control.
How about hypertension?
Yeah, stress levels, cortisol again.
So we have 3 quick examples of basically osteoarthritis affecting our risk of cardiovascular disease, diabetes, hypertension, all which can lead to obviously significant, problems and even death. So
well, that leads me really lovely, a slight little tangent. I can remember as a vet, I saw a dog that was on an established cardio, so it had a cardiac disorder. It was on an established management plan, all focused about this dog's heart disease, heart disease, heart disease. All they could think of was heart disease, heart disease. And the dog was walking around and it was so much discomfort that actually once we started working on the discomfort, the heart disease started to stabilize more. So it works both ways. There's a back and forth. And I think we really need to be looking holistically. There's a tendency for people to say it's just OA, let's focus on the heart disease or the liver disease or the diabetes. But you have got to treat all of what that dog's showing you. And OA should be stopped being put in a box and pushed to the side. It's very important.
Well said, Hannah. You're very enthusiastic. If
I'm on my soapbox.
A cardiologist named Steve Ettinger in the States from the Ettinger book. So Steve and I work together, and Steve actually, in the last 10 years or so, I've got him very interested in rehabilitation.
Have you? Good on you.
And kind of, mixing the cardiology world and the rehab world together.
Yeah.
I think, I think a lot of this does boil back to exercise too, and being able to exercise to your best of your ability. And we'll get to that in OA a little bit. So how many people do you think have OA in the world? I'm going to keep asking Hannah questions. I like being on the other side of the camera. What's your estimate of people in the world with OA?
I wouldn't know that, but people tend to suffer from spontaneous OA, so they're getting it as a more degenerative later in life. So I don't think the figures percentage-wise are as high as dogs, but correct me.
I'm going to just throw out a number from one of the osteoarthritis groups, about 250 million people worldwide. And women have a higher rate than men of osteoarthritis. So, obviously this is a big problem in all species, really. There are a few species that don't suffer much from OA. Animals that tend to stay very lean and have very little pressure on their joints. But most of us creatures get osteoarthritis. Now, it doesn't always mean that it's going to be painful either. A lot of people have OA, and it doesn't hurt. A lot of dogs have radiographic signs of OA, but yet they're functionally great. And some dogs have radiographs that look pretty good, and they have horrible pain. So
I think that's a really good point to just spend a little time on, because it features on Holly's Army a lot, where people say, well, should I just get my dog to have x-rays of everything? And we're like, no, because you will always find something, and it doesn't mean it's clinically relevant. So just for anybody that has been thinking, I love my dog to bits, I will do anything, let's just get everything x-rayed and see what I'm dealing with. It doesn't quite work like that, guys. It might not actually be clinically relevant to that dog.
Absolutely. Radiology is only is good when we put it together with the clinical exam and the signs and symptoms. I think something like 80% of humans above the age of 60 have some signs of disc herniation or bulging, and these are all people that are asymptomatic. So 80% of people that have zero pain, still, if you look at their MRI, you could find something wrong on there. So it has to be a clinical exam.
A wee little tangent. Over here in the UK, lots of chiropractic clinics are offering people back scans, back x-rays. And you're like, well, actually, no, examine me first, because you're going to find something when you do an x-ray.
Yeah, and if you go to, and I'm not saying anything good or bad about any individual profession, but if you go to a barber and you ask them if you need a haircut, they're going to probably say yes. And if you go to a practitioner and they find something, they're going to treat it. Now, is it something that needs to be treated or not? We have to kind of put that together with, an evidence-based approach, and what can we really do? And, but looking at a scan or a radiograph and treating just off of that. There's an old kind of joke that says, what do two surgeons, what does the surgeon call two radiologists looking at an MRI? A double-blind study, because
I like kind of going to use that.
The idea is that, because the radiologist is never in surgery and never sees what's going on in vivo and doesn't do a clinical exam on the patient, that imaging by itself is not as good as that. Now, that information is very important, but when it's put together with the clinical presentation and what the patient reports.
Yeah, which leads us really nicely into talking about the clinical exam. And I think that is my perfect entrance to get you to start talking about looking at the dog bigger picture. And I'm going to ask you to kind of go through what's going on in your mind as a dog walks into your room. You've never seen it before. I'm going to give you a classic. I'm going to give you an 8-year-old yellow lab, and he's been slowing down. I've noticed he's been underperforming. He's becoming distracted on walks. He doesn't greet him at the door anymore, and he walks in. So what kind of things will your brain start doing as soon as that dog comes in? And then I'm going to ask you to talk about your palpation and what you're feeling for. And I want to, go that way.
Wow, that's a big question. We could spend it could be like a 4-beer question. It could take a while to get through it. But unfortunately it's 2:11 here, so no beer yet for me, just the water. Cheers, but cheers for cameras. So, the first thing I like to do is just watch the patient. Now, in a veterinary hospital, one thing that I've changed a lot of is flooring. Mm-hmm. For patients with OA, our flooring is pretty crappy. We have these tile floors that are easy to clean, but they're very slippery. They don't allow for much traction. Dogs don't feel very comfortable walking on them.
Totally agree.
So, we have some rubber flooring. We have special flooring for our total hips, because we don't want anything to happen to them. We have special flooring in rehab. Mm-hmm. And flooring and we'll talk about home modifications a little bit, I guess. And Hannah, I know you've probably talked about that a million times, but
it's my favorite subject.
So watching them on the floor coming into your exam room, and I spent the morning in an exam room, it's not that realistic. I'd rather have the owner just take them for a couple minute walk outside, see how the dog moves, see what compensatory kind of motions the dog has. Will the dog walk quickly? Will the dog trot? Just kind of watch the dog before I do anything. And I think as a veterinarian, I'm sure you find yourself watching dogs all the time out in public.
Yeah.
And trying to diagnose, is that a hip, or is that, maybe it's the elbow on, you start to look at the head bob. You start to look at a shortened stride, a change in range of motion. But you're kind of starting to input all that data. You're looking for atrophy. Is the butt kind of nice and rounded? Does he have a flat butt? Maybe.
What does atrophy mean? People won't know what that means.
Sure. Yeah. Atrophy is just loss of muscle mass. So, when we look at dogs that have cruciate tears, people kind of talk about them having a bit of a flat butt. They lose muscle in that rear end area. That's kind of characteristic that happens because they don't push off as much as normal. And the same thing can happen with types of arthritis. So we kind of look at the amount of muscle. Is it the same on both sides? Is the dog overweight? Is the dog seem comfortable moving? If they, if they're eliminating, how do they move their limbs? Do they look normal? Do they look abnormal? We can go up and down a couple of steps. And all this is before we've even touched the dog.
Yeah.
How did the dog get in and out of the car? Is the dog interested outside? Are they sniffing at things, looking around, kind of, in a normal dog behavior? Or are they kind of apathetic? Maybe, there could be a lot of reasons, but maybe they're in enough pain that they don't really care about the things they used to anymore. Yeah. It may be that they're scared too. So you're taking in this incredible amount of information that you're synthesizing. And I've been, doing this since, 30 plus years. So, and you don't, like you say, you don't even really think about it. You're kind of taking all this in, head posture, tail posture.
Do you look at coat? Because I can remember for me going right back when I met the lovely Julia Robertson from Garland Myotherapy, And she started talking to me about mane development, you know, when they start throwing their weight forward, and then you start getting changes in the soft tissue, and you start getting coat pattern changes. And I was like, oh my God, that's amazing. And I can remember one of the most profound things in my journey, she said to me that the coats might not molt so well in areas where you've got adhesions and compromised soft tissue. And I was like, shut up, that's ridiculous. The skin is separate to the body. It's separate, it overlays. And then somebody donated us a dog to dissect. And sure enough, where the skin and the coat was smooth, the skin peeled when we were dissecting. But anywhere where there was a turbulent coat pattern and clumping, the skin was really quite adhered to the tissue underneath. And I was like, oh God, you know, I really had to eat my words, because it was obvious.
Well, yeah, I mean, it's not something that I think is commonly talked about, but maybe, I don't know. I mean, I do look at weight shifting a lot. Dogs that are, you know, shifting forward or back on the front limbs, or rear limbs, or one side or the other. What's their gait pattern? Is it a walk? Do they pace? Some dogs like to pace. We don't want to read too much into it, but
tell them about pacing. What does that mean?
So pacing is when a dog will strike with both limbs on the same side of the body at the same time. So both left will go down, then both right, instead of alternating them in a trot. And pacing is sometimes associated with limited mobility because it's a little bit easier from an energy perspective. You can kind of throw your whole body waddling back and forth a little bit easier. I think just about any dog will pace at a certain gait because it conserves energy.
Yeah.
So, these are things we think, maybe, I don't know, that, dogs.
Okay. There's back pain because of with a diagonal trot that you're going to get a bit of rotation at that spine.
Yeah. So with the pace, you're not having to, kind of maybe twist the trunk as much. And it's hard because we can't ask dogs, why are you walking like that? That kind of seems funky. Do you just want your butt to look better, kind of back and forth? Or, that's something that, we've thought that happens for a long time. But, we can always be fooled. I never, say that dog's pacing, oh, it's obviously this or that. Or, same thing with a head bob. We can be fooled because a lot of times arthritis isn't in one place. No. So, maybe it's, you've got a Rottweiler where you've got it in multiple limb, you've got both elbows, both hips. And so, we have to kind of, they may be favoring it to protect the worst limb, but they could have it all over the place.
Yeah, no, and that's really difficult. So any owner that's listening, or any therapist that's starting your journey, or a physiotherapist at college, or you're a vet that's just going, actually, I want to do more about this disease. When they have multi-limb lameness, it is tough. And I have spent hours looking at video footage and slow-mowing it down and trying to distill down where is the problem. But when you've got lameness in all four limbs, it can be really, really hard. And almost that becomes a bit academic. And I love what Stuart Carmichael does. He calls it economy of gait. When he knows that there's actually lameness in multiple limbs, he doesn't try and distill down and go, exactly, this is how much in this leg and this is how much in this leg. He says, right, it's everywhere. This dog's got economy of gait. It's not gaiting nicely. Something I look at a lot is tail. And it's personal to me because Holly had serious lumbosacral disease. And her tail lost all expression. It didn't greet me. It didn't counterbalance her. It wasn't her communication tool anymore. It quite often had no function. And that is really, really important to me because I can remember as a newly grad vet, someone came into me during a consult and said, my dog doesn't use his tail anymore. And I said, oh, he must just be getting old. And I hate myself because I didn't know.
We all remember patients from 20 or 30 years ago that we wish we could do something different with. Yeah. So that is a normal, I trust me, I can remember patients from over 30 years ago that I'd like to go back and treat again.
Yeah. So I was listening
to that's a good thing. If you didn't care, you wouldn't think about that. So
no, it's one of those things, but I think I think Cam is driven a lot by guilt, because I know there's so many things that I could have done better. But I started being interested, and I started learning from people like you quite, well into my career. And I now look back and think, oh God, if only I'd known all this. Okay, so you've already connected.
You've got to keep learning all the time. I mean, that's what, I joked about I'm taking 2 courses this semester. This past summer, I took a statistics course. I'm always taking different things in, virology right now. If we stop learning, I think we can't stop learning. We have to continue to integrate what we learn into our clinical practice. You can't do one or the other. I mean, so it's dangerous to try to stop. We've got to keep pushing forward.
Definitely, but you are actually just a walking alphabet, the amount of courses and qualifications that you have now.
It's kind of a hobby, though, besides, working out, and usually one day a week I try to boat a little bit. I like to learn things instead of, I could probably be more balanced, but it's what I enjoy. And it also, when you work in multiple professions, working in infectious disease and veterinary and human medicine, and each one actually helps inform the other. You pick up tricks in working in pediatrics that will help you with dogs. You pick up ideas that in EDS patients, we don't exactly have EDS per se in dogs, kind of similar connective tissue disorders, but then when we see that patient, what are we doing in people that might help in dogs, or vice versa? So I think for me, it's what kind of keeps me invigorated, kind of, really collaborating with all kinds of different folks. And, it just makes it fun. It is true that on any given day, I do something different.
Which is good. And just a little bit of a tangent and big you up. If people are like, oh my God, I want to know more about this guy and what he does, you can quickly say that you do a lot of teaching. There's a lot of courses that you're involved with. So if you're wanting to take your education further, guys, so if you're therapists, physiotherapists, vets, vet nurses, we'll put a link. I'll put a link to all of the sort of things that David Levine's involved with, because he's taught me and I've learned huge amounts from him.
And you're welcome to put my email out. I mean, I'm always happy to share. We take a lot of different interns at the hospital, and I collaborate in research with probably people on 3 or 4 different continents right now, and we're always looking for more people to join our teams. And so that's we're all here to try to get better, to help our patients better. That's the bottom line, and have fun doing it. We want to enjoy our lives too.
Yeah. And we have got a question down here. So Lindsay, please pop over to Holly's Army. I'll get one of the ambassadors. Lynn will put a link. Tonight we're not going to talk about supplements. This is much more about the physical aspects of managing OA. Supplements are featured a lot in other Facebook Lives, so there is loads and loads of content on Cam for you about this. But tonight's going to be very much about looking at the secondary effects and what we can do for that. So let's jump into, now the dog is in your room.
Okay.
You've collated a load of information from looking at the dog's posture, standing, movement, transitions. Transitions means from a sit to a stand, a lay to a sit. And you've started building a bit of a picture, but you're now wanting to put your hands on. What do you do? And the reason I'm asking this is, as a vet, there's a big tendency for us to go to the joint that we think is the problem, and straight in, like swimwear, in there, swimwear, get a hold of that joint. Whereas now I don't do that. I have a process. I start at the front and I go all the way through, even if I think the problem's in the hock at the back. I tend to go to where I think the problem is last. Why? What do you do and why?
Well, I think it's good, no matter how you do it, to have a system. And your system is, you start with the 4 limbs, you kind of go through joint by joint, and then so you're not missing anything. You're doing the same thing every time. I think one of the things in veterinary practice that's tough is the amount of time you're given to see a patient. If you've got, a 30-minute appointment, or sometimes even 15, you can't do a really good job on an, evaluation assessment of a patient with OA. It's going to take, our initial appointments, we schedule an hour. And owners will say things like, no one's ever looked at my dog that closely before. Well, they probably didn't. It's probably nothing bad about them. They just didn't have the time. So, I definitely, if we are thinking, that it's a rear left hip or a left hip, I may go through the forelimbs first. We're certainly going to look at each joint, but the point I'm making is I typically do the more non-affected side first. Let them get used to my touch, give me an idea of what the better side feels like before I feel the affected side. And we look at muscle mass or muscle atrophy. We look at range of motion. We look at willingness to move, any crepitus, any reaction of the dog to that motion. We might look at laxity of a joint by some ligamentous tests. Weight bearing is tough to really evaluate without something a bit more objective. I wish we had a better way. What I mean by that is you can have a dog that's standing there in front of you, and it looks like it's standing on all four legs pretty equally, and it's only putting, normally a dog, they put more weight on their front legs because more of the heavy part of the dog's in the front, the chest cavity and the head. So they put about 30% of their 100% of body weight on each forelimb. So the right front leg, 30%, left front leg, 30%, and about 20% on each of the back limbs, adding up to 100. You could have a dog that's only putting 10% of body weight on the right front limb, and you could not even tell they're doing it. They're so good at kind of hiding that, decrease in weight bearing. Now, when they start walking or trotting, we might pick it up, but they're really masters at kind of hiding that unloading of a limb and shifting that weight to another limb. They might give you some signs, but they're very good at it. And cats are even better than dogs at it.
Do you use stance analyzers over with you?
So I think stance analyzers, force plates, all those things are great to use, but most clinics won't have them.
No.
So I think what most people do is try to get the dog to stand squarely, put their hand under the dog's, front paws, have the dog stand on your hands, and then do the same with the back legs and at least try to get a feel. I love stance analyzers and things like that, but they take a while to use. And they, typically start at about 10,000, 10 to 12,000 in the US. Yeah. So not every clinic is going to have them. So great idea. But basically,
because from a vet perspective, and we talked about this a lot last night, we always try and see things from the vet perspective and the owner perspective and try and meet in the middle. It's not anybody's doing anything wrong. We're just both dealing with time constraints, stressful environments, etc. And definitely with the stance analyzers, they are very useful for the owner to immediately jump on board and see it. And that's what I found when I've used them in front of an owner. They go, oh, crikey, I would have never have thought. Whereas when you don't have figures in front of them, that owner has to believe you, which can be quite difficult. Okay, so you've done your orthopedic look over. I'm really pushing you hard to start talking about soft tissue because I want to end the Facebook with lots of owners like the lovely Margot Molson down at the bottom from Canada, who's asking what more can she do to prevent soft tissue injuries. So we're going to get there, Mrs. Molson. So I want to push into the soft tissue so that we can talk about interventions that are going to be game changers. You've done your orthopaedic exam, you felt your joints, you have got crepitus, you maybe have got a bit of an effusion, so a bit of joint swelling. You've got that under control. What else are you looking around that joint? So let's use an example that we've got an effused left stifle, restricted range of motion. We've got a medial buttress and crepitus. We've got some muscle mass loss on that side, and you've already had a conversation with the surgeon and you know that you're going to be doing x-rays and we're going to go and look for cruciate. But what have you felt over the rest of the body and what might you be thinking to help this dog?
I got you. So in that case, we're probably, 90% likely that we've had a cruciate tear some time ago. We don't know how long ago, and whether or not they do surgery or not, who knows? Is the joint stable at this point? But I think what we're going to look for is, because that dog has probably not been putting a lot of weight on that leg for a while, where has it been putting it? Is it is it shifting the weight forward? Is it shifting it to the other side? Is the back have some compensatory kind of motion? Now we kind of need to look at the whole dog, because if you stop using one limb or you're using it abnormally, then you're going to make changes in the rest of the dog. And in people, if you put a rock in your shoe and you walk around for all day with that stupid rock in your shoe and you don't take it out, you're going to start moving that limb funny.
Mm.
You're going to start to develop back pain. You might start to develop pain in your opposite hip because you're putting more weight on it. It doesn't take long to start to piss off other joints and other soft tissues when you're not using them correctly. Yeah. So I don't know if that's where you were leading me. What?
Totally heading that direction. Sorry to kind of pick you up and shove you there. But we have lots of vets and people come on and do talks about joint pathology, joint supplementation. But I've really wanted someone to open the door to soft tissue influence and how actually it's accessible by lots and lots of people for not great expense. And that's where my heart is. Like before we went live, I said, I really want to help people that haven't got a huge amount of money to throw at the situation. They might not have the time availability. They might not have the access to a physio or a hydrotherapy center. What can they do? And how can we teach them that their interventions can make a big difference to pain state? So we're going to just stay in your soft tissue world, which you're amazing at. So
why don't we define the soft tissues for folks that may not, when we talk about soft tissues, we have, Hannah, do you want to do it? Do you want me to do it? We obviously have.
Go.
So, the muscles that are surrounding the joint are one of the soft tissues. Mm-hmm. But before we get to the muscles, we have things like the joint capsule, the capsule that holds the joint together. The synovial tissue in there, there's tissue in there that, lines the joint. That can become inflamed, and that can create a lot of pain. Mm-hmm. So we have things like our joint capsule, our tendons, our muscles, our ligaments, our fascia. Any of these are connective soft tissues. Any of them can cause pain. I mean, pretty much if we look at the body, pretty much if we take Hannah as an example, she's got receptors that can cause pain in just about every part of her body. Mm-hmm. A few places really don't. We cut your hair, shouldn't hurt.
No.
Cut your nails.
Just my pride.
Just your pride. You cut your nails. I mean, there are a few places. It's good that our nails and hair don't have those receptors because, we don't want them to. But pretty much, any of the tissues in our body, just about all of them have these pain receptors, which are there to help protect us. But then when also there's an injury or just overuse, or like we said, there's an altered muscle loading, a change in the way the muscle's normally behaving, it creates stress and pain. Mm. So we have a lot of different soft tissues that can hurt as a direct result of being around that arthritic limb, or secondarily affected because now we're walking funny, and go back to the rock in your shoe, and you're going to, piss off some of the muscles and soft tissues in your back and other places.
We can relate to it. So I'm going to just tangent quickly. I've gone from being a vet who stands by a consult room table and always moving. Vets are very mobile. They're by the computer, by the consult room table. They're picking up the dog. They're getting in the kennel. They're over the operating table. They're always busy and moving. And I did that for 16 years. And I've taken a job where I'm on my laptop a lot more. I'm driving a lot more. And I've lost a lot of strength through my gluteals. My hip flexors have become very, very tight. And I've now got pain. I have got pain that goes down the front through my quads because they're really tight and restricted. So what I'm trying to say is when you have a change in your routine and a change in your use, then you do start having associated changes, and some tissues get overworked and some become underworked, and it becomes a negative spiral. But people tend to forget that they are also capable of creating pain as well as dysfunction. And I have so many owners come in, and because they've been conditioned to think that the pain is only coming from the joint, they can't see that the rest of the dog is potentially sore, and we can intervene there. And a good example, and I'm going to pat myself on the back for this one, I had a dog come in to the waiting room, and it was coming in to be put to sleep. And I had my consultation because the practice was empty. I could sit in the waiting room with the owners, and we had a good 20-minute chat whilst they were prepping themselves. But at that same time, I had the opportunity to massage this dog's neck. And the dog had come in recumbent and carried in, and he just stood up and walked out. And they were like, "What? Excuse me?" And I was like, "Well, yeah, because the dog was like, I've just had too much, the pain that now is in my neck from soft tissue has broken, it's the straw that's broken the camel's back." You start remedying and lifting different areas of pain away, and then it goes, I can go back to cope mode. So that's why this Facebook Live is really important to me, because I think there's a lot of dogs out there, and I'm going to say it, I think there's a lot of dogs out there that are potentially being PTS'd, put to sleep, euthanized, when actually it's soft tissue pain that we can do stuff about. Would you agree?
Oh, yeah. I mean, I think the number one reason that dogs are put down in the States is loss of mobility. They can't get up and down on their own, and owners have to carry them everywhere, carry them outside to urinate or defecate. It's really, we know in cases of things like degenerative myelopathy, that's when they're euthanized. It's when they can't move around. And so I think that is a time when people kind of give up. So the longer we can keep mobility and the pet functional, then hopefully we will push that time off until there's, natural death. Yeah.
So you've talked about pain coming from soft tissue. Give us some examples. So I gave David a brief about talking about muscle strains and talking about trigger points and talking about fascial related pain. Can you just kind of list off, so people, we've got the dog with cruciate, left cruciate, dog's been placing only 5% weight through that left hind. He's been throwing a good 25% in the right hind. He's been putting 40% over in his diagonal right fore. He's had a little bit of a lordotic back. So he's had a bit of an arch of his back. He's brought his back legs underneath him. So he's basically been walking around a little bit like Quasimodo for a while. What sorts of pain do you think that dog might have? And what sort of things would you go, oh, I'm going to use this. I'm going to try that. I've got this little tool, or I'm going to tell them to do this. Well, because they can't have surgery for 3 weeks. The dog's got 3 weeks. What we're going to do?
And they can't tell us what they think is going to help the most. So, I mean, when a dog's got that many issues, you gave me a big list there. And, we have to try to figure out what we're going to, we can't spend 3 hours treating everything on the dog. So we have to try to figure out what are the worst areas of pain to try to treat, today. We might do that by some palpation, feeling different muscles, putting the dog through a couple different movements, but not excessively, because we don't want to cause him any more pain. Mm-hmm. So, want to look at areas that are maybe more inflammatory than others. If they're totally lifting a limb up, like, for example, a hind limb, then we might look at something like the hip flexors or iliac psoas, because they're going to be contracted for a long period of time. If their back is really functioning, and people, they'll do dry needling into that area. That may be a treatment where you take an acupuncture needle and you stick it into the trigger points and things like that.
Tell people what trigger point is.
That's another whole hour discussion, because we can argue about what trigger points are, but basically those knots or tight bands that you feel in muscle where they've been in a kind of a sustained state of contraction. In people, the main areas we see them are the upper trapezius, kind of one right here in the neck, and then the levator scapula right at the medial superior border of the scapula. Those are probably the two most common ones. In dogs, we don't have as good of a trigger point chart. There's a few papers on them and a few places where they're common, like in the case of a dog with a forelimb injury. You might look at, the other forelimb triceps, where they're bearing a lot of weight on that. But, to say that, Michelle Broadhurst, I'm not sure if you've talked with her.
Not yet. She's in my radar.
So she has a new book on myofascial pain in dogs. And a lot of it is, it's mainly based on experience. We don't know, that much about trigger points, but I think she has some really good ideas on how to treat those soft tissues
Mm.
And I think a lot of it goes along with what we're talking about here. So these soft tissues become inflamed. They release basically chemicals that cause more pain. If you kind of picture the soft tissues bathing in this fluid, some of what is in there are these different chemicals the body releases and causes pain. That's part of what happens in OA. And some people call it a milieu, but it's basically like this chemical bath that the body releases around those different soft tissues. So how we can get, rid of that or decrease it, that's, I guess, probably what we're going to end up with in this talk, is trying to figure out how to help as much as possible.
Yeah, no, definitely. So I'm kind of like, in my mind, I'll be looking at a dog and I'll be looking at their posture and I'll be looking for where there is the weight shift to, and I'll be feeling the muscles and feeling if some of them feel really hard and solid and they're overworking, and I've got some areas where the skin's not moving nicely across them, and I might feel a muscle belly and I get a really pronounced reaction from the dog or a local twitch. I'll feel up and their shoulder blades are locked in. There's no movement here because they've carried the weight and they've thrown the weight forward, and they've got this kind of like all the weight of the world on their shoulders and in their neck, and their neck feels solid. So in my mind, I do have the ability to use drugs. Don't get me wrong. As a vet, I will be dispensing my non-steroidals. I might use some adjuncts. I don't do acupuncture. It's on my list to do, but I do a lot of massage. And I will get in there feeling and moving tissues around. I'll do a little bit of range of motion in joints, so try and get a bit of joint mobility back. And I might add a little bit of weight shifting and therapeutic exercise. And all of what I love about that is it's quite free. It's not expensive.
Right.
I think that's really important for people to know, that what we're talking about tonight isn't going to cost you the earth. It's accessible, it's available, and it's very powerful. There are other tools that we do use. So you're in the world of amazing tools. So you have your TENS, your NMES, you have your hydrotherapy, your underwater treadmill, you have lots and lots of things at your disposal, your lasers and stuff. But what do you tend to use the most when you're doing this? Do you go straight for tools, or do you?
No, I think first I look at what can we do to make the dog comfortable. Look at the home environment. Do we need a sling? The dog is uncomfortable bearing weight. We grab a crutch or a cane or something as a person. We don't have really that for dogs, but we can put a sling or a harness under that limb. The owner can walk with them, and then you've taken some of the body weight away. So, that's getting a bit more at the cause, because we can put tools on there, but if we don't get to, decreasing the workload on that area, they may not help as much. Yeah. So, what are the surfaces at home? Does the animal have a comfortable place to sleep? Are they, people don't realize that my dog should have a comfortable bed. Generally, animals will find that unless they're chased off the couch or something, but maybe they can't jump up on the couch anymore. And they end up, sleeping on a hard floor. So, we have a cat that was a rescue that sleeps on a hot pack frequently. Cat that's incredibly immobile. I was telling Hannah about it. It has one tooth in its head. It's, got horrible arthritis everywhere. And it can't really walk more than a few feet, but it loves to lay on this, heating pad, which we had at the house. And, it just loves to lay on that for some pain relief. And it's
tell people how that works. Tell them a bit about that, because everybody can access heat. It might be
I think first you need to make sure it's on a low enough setting it's not going to burn the animal, and check. So the heating pad happened to be laying on the bed, and it had been on, someone had been using it, and the cat climbed on it and realized it loved it, and then kept wanting to lay on this heating pack. So you want to check the skin, make sure it's not too hot or anything. This cat also, because it's a rescue and very immobile, and this cat's arthritis is so bad it can't really clean itself. And anybody that knows cats, they spend a lot of time self-bathing. This cat actually needs to get a bath every couple days, because from the litter box, it actually gets the litter embedded in its paws, and it can't actually even get the litter out.
Mm.
Immobile. And this cat loves a warm bath in the sink with a little hose. So, I mean, not every cat is going to love that.
But a lot of cats will seek sunlight, won't they? You'll see them go and find like that.
Yeah.
And dogs do it too. I had a dog that used to lay near the radiator, and she would actually lay her back towards the radiator. So she was like seeking something that felt good. So she didn't say, Holly didn't go, so this is really good for improving blood flow, so I'm going to sit here because I know it's going to help with tissue elasticity and lymphatic flow. She actually just went, this feels really nice.
Yep.
But
dog that did the same thing, laid in front of the heat vent. That's kind of where it liked to lay in the winter when the heat was on.
Yep. So when people say animals can self-medicate, I do understand that concept. They go to somewhere where it feels good, and it is doing benefit. So guys, as I said, the importance for me is trying to give you options that you can do. So Carol Tyndall, I'm going to answer your question later, I promise you. But things like a simple heat sack, a wheat sack that you can get from a local store, you know, they're only about 10 quid, and you can put them in the microwave for a couple of minutes and you can use that. They're accessible for people, you know, a lukewarm hot water bottle. But where would you kind of put it? So if we've got an owner that wants to do something for their dog, what kind of areas do you use your heat therapy in?
Well, I mean, probably hips, the back, those are the most common. I think, you know, if you introduce the animal to it, they may lay on it in the way that feels optimal to them. So if the right side's worse than the left, they may lay on their right side on that as well. So, I mean, you know, in the clinic, sometimes people apply heat or cold to a specific area by holding it on something, but then we know they've had some diagnosis. It's not just, you know. So.
I think you always need to give them choice. So whenever I used a heat sack on Holly, if she chose to move away from it, that was the answer. So anybody that's gone, oh great, I'm just going to go and get my heat sack now, put it in the microwave, and I'm going to press it on my dog's back.
Right. Well, and you know, where I live, it's warm, and in the summer when my dogs are outside, they dig a hole. And by digging a hole, it's cooler down there, like, you know, wine cellars or, you know, cooler temperature. And they give off heat to the ground, so they help cool themselves by digging a hole. They're pretty smart about regulating temperature. But we mentioned slings or supports. I think those are underrated. If you can't afford a sling or support, you can take a beach towel and put it under the belly of your dog and give them some support while they're walking.
There's we over here in the UK have something called the Bag for Life, which is to stop people having lots of plastic bags in the supermarkets. And I've seen many people cut down the sides and they make the holes for the legs, and they actually use that as a sling. So that is a very simple kind of short-term adaptation. There is a company that we love called Orthopaedics that do the Help 'em Up harness. And this is a big thing that I have a soapbox moment about. I don't like seeing people introduce the back end support when the dog can't walk. That needs to be introduced while the dog still can walk. It's part of your rehab plan. It's not there as your, oh, we need to find him something now because he can't walk at all. When you start seeing the dog having problems, and for me, I would indicate that to the owner by a gentle push across the hips. And if the dog really can't counterbalance it and it really throws them off kilter, and that's a repetitive thing, they're that weak and they're really struggling, I would be saying to them, that's now, because there's a potential that by supporting that dog, you'll actually maintain the tissue, maintain function, rather than waiting for no function and then you've only got that option. So that's
just point. Yeah. I think sometimes people are reluctant, and I know in the States, people are very reluctant to use assistive devices until they're really, you know, really need them. When I travel in Europe, I see a lot more elderly out with canes and walkers and things. It's much more accepted, at least in some countries I've traveled to there, than in the States, which is kind of interesting.
I didn't realize my dad was American. Dad, I didn't know you were American. Wouldn't it be nice if you start using assisted devices? Thanks, Dad. But no, it's true. It's true. And that's a really simple thing that people can do. Let's just talk about flooring, because again, I would say of the 77 people that are watching this at this moment, the majority of you have got laminate, tiles, wood, or something in your house. You know, What kind of products are out there that people could use? I'm a strong suggester of rugs and runners, rather than looking at putting something on the dog. You know, rubber back runners that don't slip. I think you can get used to the sight of a rug. You can't get used to the loss of your dog. And I am that blunt. If you don't do something about it and that dog keeps falling over, their progression with their OA, their disease is going to get worse quick. And you will come to endpoint quicker. But if they're in a house, say, with somebody that has got mobility problems themselves and is a trip hazard for, say, their granddad still lives with them and he is likely to catch his shuffly feet on a rug, what kind of things do you offer to owners that they can use to try and prevent slipping?
Well, I mean, I agree with what you said in terms of what we can put down. I mean, I think if you give the analogy of a person, we've all stood on a hard surface. You know, some ORs are very hard. Some places that we walk on are much harder than other places, and they're much less comfortable, and you feel sore by the end of the day. Mm-hmm. So I try to use that analogy to say, you know, if you go for a hike in the woods and it's soft, you know, it's going to feel better. So whatever the answer is, whether it's a runner or a carpet that we can use double-sided tape or whatever, we just trying to create a comfortable surface. We don't have to change your whole house.
No.
You know, you may love your hardwood floors. Great. We're just trying to, you know, provide a little bit of a better surface. And it's not like the dog is, you know, going to be running laps in the house. I mean, I think it's home modifications are very important. But they don't have to be, you know, expensive or difficult to do. So
no, I had one owner at a carpet shop. She just got all the leftovers there. So she knew that her dog wasn't going to be with her for more than 6 months to a year. So she went to a carpet shop and she got the leftovers, and she made sure that she had anti-slip tape underneath so the sections didn't move. But in just the high traffic zones, the comedy kind of like ironic one that I always say is, I bet you if you have a dining room and a dining room table, there's always a blinking rug underneath it doing nothing.
Yep. You don't even use the dining room table, so we just in the kitchen by the telly or something. So
put it down. But what about do you use and encourage people to have paw friction, Dr. Busby's claws? There is a grippers. Do you have stuff like that over there in the States?
So yeah, and so for those that are a little unfamiliar with them, these are either products that you can put over the nails. Some are just a tight fit. Some are glued. There are products you can put over the whole foot to help increase traction. They work okay in some dogs. Some, you know, dogs with neurological disease. Let me adjust my camera there. I'm moving. Dogs with neurological disease that might really need some traction. And some dogs hate them. And some dogs try to eat them. And then we have a foreign body, and that's a very expensive issue. So, you know, it's something you can try on some dogs, and some dogs, they work very well.
Have you used paw friction? And by the way, they're not sponsoring this live, but I actually have been impressed with paw friction.
Okay. I have not used that product. Am I frozen, or can you hear me okay?
Oh, frozen. It's quite a happy face, though, so it's okay.
Okay. Hopefully it will come back in a second, as long as it's recording.
Yeah. I think your camera's stalled.
Camera's not happy.
Do you want to turn your camera on, off, and turn it back on again?
Okay, I'll stop it and start it and see.
But in the meantime, guys, whilst he's playing with his camera, so we're not getting, no, it's the same.
It's all right.
Carry on talking, we'll be all right. But paw friction basically is a product that I was a bit cynical about, that I have trialed on my own dog, on other people's dogs, and I've also used it on a very young, agile dog on a laminate floor, and I've tested out what impact it had. So N=1, it's the worst study you could have. But we videoed this young Labrador on a laminate floor and watched how it got from a lay to a stand and moved away, and saw that his feet slipped away from him. Then we put the paw friction on, which is basically a tissue adhesive that you put onto the main pad and the digital pads, and then you just dip their foot on some very, very, very fine rubber etchings. And they don't seem to have any discomfort from it. They don't seem to be agitated by it at all. But it was insane how much grip the dog had transitioning and moving away when that was in place. And I say to people that are going on holiday to a holiday cottage, or they're going to go and stay with their family somewhere, and they know that they're going to, oh, you're back. Hi.
Well, it's a different camera.
Different camera.
Yes.
Yeah, if you're in a situation where you can't put rugs down, then that is a good backup plan. For your information, Dr. Busby's are little rings that you can put around the nail, and at the back of the nail, they should offer just a tiny little bit of grip where that rubber ring hits the flooring. I put them on Holly. They were quite hard to put on, and we lost them quite regularly. The ones that did stay in place were okay. How well did they work? Well, we didn't get on so well because she was already beginning to rock back onto her metatarsal pad, so she wasn't engaged in her claws so well anyway. We tried an array of socks. I spent a fortune. I tried everything. And there was one called Grippers, which have the grip at the base of the sock, and they just spun round. And she ended up having woolly socks on her feet, which made it so much worse. So take it from me, guys. I have tried and I've tried and I've tried and I've tried. And the best thing I've found is rugs. Rugs. So if you have got this conundrum where you're seeing your dog slip away, and I want you to promise me, guys, after this live, watch your dog. If you see that their foot even just keeps slipping when they walk, that amounts to anxiety, stress, fear of activities on the surface. It also recruits other muscle groups to try and stabilize, because they know that that foot and that push off isn't going to be as secure as they want it to be. They've also not got the same coping mechanisms because they've got muscle mass loss, proprioceptive deficits, weight shifting. So a slip and a trip, they're not going to cope so well with. So if you're seeing that your dog, when getting from a lay to a stand or a sit to a stand, or they're walking across the kitchen, and you're seeing little slips, or near the front door, English houses, the hallway, wooden laminate hallways, high traffic zones, but the postman turns up and the dog goes flying to the door and the legs are going everywhere and it slides into the door. No, it really, really will progress your dog's clinical signs. Is that fair to say, or am I playing a bit of a dangerous game? Are you feeling uncomfortable with what I'm saying?
No, and I'm feeling uncomfortable with my stupid camera, but
no, you look fine. You look fine.
So I guess we are we're probably getting toward the end, I guess, and I guess a couple of things I wanted to say just from my 30 plus years. Osteoarthritis is a serious problem, and I think sometimes we don't treat it as a serious disease that it is. But it's highly prevalent across the world. The prevalence is increasing. The risk factors, we're learning more about those. There's no known cure, so avoid these kind of crazy ads that say we can cure osteoarthritis. Run from those places. And there's a significant impact in years of life that are lost because of this disability.
Yes.
So that's, kind of sobering news. There's also a significant impact on the comorbid conditions, the other conditions that, your pet is going to have. There's an increased risk of dying prematurely from OA.
Massively.
There's a natural history of it progressing. So we're trying to slow that progression. Most of our treatments have a reasonably small effect. But they have an effect, but their effect is not as big as we'd like it to be. Would you agree with that, Hannah?
I totally agree with that. Yeah.
The things we know we can do: exercise regularly, keep it a good weight. Those are two things. Exercise does a lot of things. It increases the fluid that lubricates the joint. It's much better to exercise an animal with OA 5 times a day for 5 to 10 minutes than once a day for an hour. Yeah. I spend a lot of time getting irritated at people who love their pets and they remember that pet loved to go chase a ball. That lab we started talking about at the beginning, I see this all the time. I tell them, you know, at this point we have some problem, we have a flare up, we have a cruciate tear. It's on leash activity only. As soon as they get home, the dog's out running around and they're throwing the ball to them because that's what the dog wants them to do. Or the owner works hard all week and on the weekend they take the dog to the beach for an hour and a half. The dog runs around and it feels like crap for the next 2 weeks. It's much better to do short duration supervised exercise. 5 times a day, I tell retired folks, take your dog for about 10. If they can do 10 minutes 5 times a day comfortably, then we'll progress. But let's stop this hour-long jaunt on the weekend that leaves your dog lame for days.
You've just said something really important that I want you to say again. We can do 5 times 10 minutes and then we can progress. Now, that's something that's really important that owners need to know. They have a terrible tendency to hear the words, let's restrict exercise to little and often. And they think that's where they're going to be for the rest of their life. But actually, you're basically taking a step back. You're allowing the tissues to have a little bit of a chill out, start kind of coordinating, organizing, get the background in place, get the weight right, get the anti-inflammatory on board, get structure, and then you can start building that time frame up again as those tissues progress and improve with you. But a lot of people don't stick to our advice because they're like, well, my vet told me to do little and often for the rest of my dog's life. So I don't want to do that because that's not what he wants and that's not what I want. No, it's a moment in time.
I get back to the individual. I mean, if you have bad arthritis, your hip hurts. If you walk for an hour, you're going to hurt like hell. But if you walk for 10 minutes, you might be able to go around your block once or twice and not be bad. So do that, then do something around the house for a couple hours. Do that multiple times a day rather than that 1 hour walk. Or do something that's aquatic or on a bike or non-weight bearing. We have to keep the joint moving. The human body and animals, our bodies are meant to move. You mentioned you've been in the car a lot lately and you're stiffening up, and our bodies are not meant to sit in stupid chairs for 10 hours a day. They're meant to move. The way we're built is we're built to have movement throughout our day. So we have to keep that going.
Yeah. So that's when you can bring in your snuffle mats, your licky mats, your scatter feeding, your hide and seek games, all of these sorts of things to get that dog up and moving on a regular basis throughout the day. Exercise can be within your garden and within your house. It doesn't have to always mean a leash and going out. Yes, it's good for their variety, but do realize that moving around in your home and garden is still mobility and moving those joints, which is what we need. I could talk to you for hours, but we are very time limited and you've got to get back to work. I'm hugely grateful for your time. It's a real honor to have you here. I'm going to get your t-shirt in the post. They're going to come out to you. I expect to see you wear it.
Okay. Well, I'll do another one in 6 months, and we can pick maybe a very small topic that we can actually get through. But I'd like to thank you for all that you're doing for pets with arthritis. I think you're increasing awareness worldwide in a very altruistic and wonderful way. So
thanks. Well, I think being an owner and having your dog go through years and realize that the people around you don't understand the hell that you're going through as an owner is a definite driver. So anybody that's listening to this tonight and you're feeling like I need more help, go to Holly's Army. It's a beautiful place where owners will look after owners. If you've got questions, put them below. I will get to them. I will promise you. If you're a bit shy to put your questions there, then go to our forum, which is caninearthritisfoundation.co.uk. But we have got so much material on here. Do go and have a look. And if you haven't got the answer you want, pop over to Holly's Army. I do a live on there every 2 weeks where I answer your questions personally. So you can go there and I will do my damnedest to answer your questions. But from Cam, thanks, Dave. You've been awesome.
Thank you, Hannah. And you'll have to come do our paddleboard race one year.
Yes!
We have a 31. Hannah said that she does stand-up paddleboarding. We have a 31-mile race on a river here. So
Oh yes.
You have to get with your dog though, with the dog, or I'll lend you a dog here. So
yeah, no, I'll do that. 100%. 100%.
All right.
Alrighty. Well, take care, and I'll
Thank
see you soon. Bye.
All right. Bye-bye.